Good morning, everyone. Welcome to UAB's virtual town hall. I'm Rosie O'Beirne. I'm with University Relations. Just going to give a few housekeeping notes before we get started. We are recording this session and we will make it available on UAB's Vimeo and YouTube channel later today. If you need closed captioning, we have live closed captioning and you just need to click on the button on the bottom toolbar. Today we have some brief updates from leadership. So you will hear from our president, Dr. Ray Watts, our provost, Dr. Pam Benoit, and our senior VP for finance and administration, Alan Bolton, as well as our CEO of our health system, Dr. Will Fernani. And then afterwards, we will open it up to Q&A. And if we don't get to all of your questions, we will collect those most commonly asked questions, and we will do a follow-up in the next e-reporter, so be on the lookout for that. So without further ado, I will hand the floor over to Dr. Ray Watts.
Thank you very much. It's a pleasure to be with you this morning and to add my welcome. We are having this town hall so that all of our faculty and staff can be updated from our leadership team and have the opportunity to ask questions that are on your mind. As you know, earlier this week on Monday, we did announce some additional expense reductions to deal with the projected revenue decrease and potential loss of over $40 million for the university and almost $230 million for the health system through the end of our fiscal year, which is September 30th, 2020. We have made a wide range of expense reductions, and the last option we have had is to consider our workforce and our limited business model and how best to deploy all of our valuable employees. We did announce the furlough of about 325 of our employees in the university. And this is a temporary furlough from May 10th through July 31st. And we will maintain everyone's benefits, including all of their health insurance. And our HR team will apply automatically for state of Alabama unemployment benefits and other CARES Act benefits that you may be eligible for. The health system, facing such a larger financial challenge and trying to restore our clinics and hospital activities over the coming weeks and few months, had to take a different tact, and they are enacting partial salary reductions on a sliding scale for our faculty and staff at various levels. This is through the end of December, unless we can reverse it sooner. Same with the furloughs. If our financial situations change and we can bring back people sooner or restore full salary sooner, we will do so. Our primary goal has always been the safety and health of our employees and our students and the patients we serve and our community and state, and to do all we can to help others around the world because of our experts and the skill of our faculty and staff. And we want to keep that always foremost. We are still in a limited business model, recommending that our employees who are not essential on campus continue to work via remote access, and the majority can do that. These ones who are being furloughed are the employees whose position right now they can't do their job because they need to be on campus or they need to have a full activity schedule for the university and the health system. But let us let you know that we will follow all safety guidelines, and we are studying how to begin to bring our faculty and staff back more fully to campus. Dr. Benoit is leading a campus-wide task force. Dr. Vickers is serving on the system and multi-campus task force as one of the co-chairs. Good news is that our hospital, our world-class laboratory medicine team and pathology team have really increased our ability to test and test with a very high reliability. We can now do well over 1,000 or 2,000 COVID tests a day. And we're now capable of doing over 1,000 serology, that is antibody tests a day. And these are not the antibodies that aren't accurate. These are very highly precise COVID-19 antibodies. Dr. Vickers and Dr. Irwin and our public health team and others are working on a plan to be able to use our COVID-19 tracker system to know the COVID status of our employees and to know how to make sure we bring back employees safely and we protect our employees from being exposed to others. And that's why in the Birmingham city limits, we have a face mask ordinance. And we worked with the mayor on that and felt that people in public needed to wear a face mask to protect others in case they were an asymptomatic carrier at the time. So we're doing everything we can to make sure that we are as safe as possible, but we want to restore our research and our clinical activities, and our summer is already set as an online or remote academic session. We are planning on the return to campus as of the fall semester. Now that's a very fluid situation and there's a lot to be done between now and then. I would remind you that this virus is still very active. Over 250,000 people in the world have died. The number of cases in Alabama have gone up 20% in the last week. So it's not leveled off or going away. And what we are planning to use is our expertise and skill to use testing and tracking and tracing to be able to partially in a graduated way bring our employees back to campus, but to make sure that they are safe. And we will follow all social distancing guidelines and all hygiene guidelines and face mask guidelines as we return our workforce. I'll stop there and I'd like to turn it over to Provost Benoit, and I'd like to thank her and her team for such a successful virtual commencement this past weekend for our graduates. Dr. Benoit.
It was a great commencement. Good morning, everyone. I wanted to talk about two things this morning very briefly. The first is, you are probably aware that we had an optional pass-fail process during the spring, and we now know that 16.5% of the students chose pass-fail. There were more undergraduates than graduate students who chose that option, and the highest number by class were seniors. Two of the top schools with pass-fail were Arts and Sciences and Business. We'll continue to collect that kind of information for summer as well. And the other one I wanted to talk about is the Transition Back Task Force. So the task force began with a set of principles. These will not be surprising to you. They're derived directly from the strategic plan for UAB, that we want to preserve the health and safety of our university community, that we want to maintain and deliver on our mission of education, research, economic development, community engagement, that we want to preserve and maintain university operations, that we want to remain fiscally solvent, both now and into the future, and that we want to treat our community in a fair and equitable manner. There are a number of subcommittees working on the transition back. These include subcommittees on students, faculty and staff, health, safety, facilities and services, research, clinical experiences, and communication. And each one of those subcommittees is working very hard to develop protocols and guidelines so that we can have a smooth transition back in a safe and very productive way.
So now we'll hear from Alan Bolton.
Hey, good morning, everyone. I've been asked to update everybody on the university's financial outlook, both for the remainder of this fiscal year and for the upcoming fiscal year. We'll start with the remainder of this fiscal year. I think, as everyone recognizes, our fiscal year ends September 30th. A few weeks ago at our last town hall, we provided an estimate that our COVID-related budget gap for the current fiscal year would be between $52 and $77 million. With new information that we've received and new estimates that have been provided within the last 10 days, we were able to lower our gap range to a low end of about 45 million to an upper end of in the high 60s. We now have increasing confidence that the real number, the real budget gap, will be at the lower end of that range, probably between 45 and $50 million. We announced some actions this week, as Dr. Watts mentioned, to help close that gap. And we've also asked each dean and vice president to give us their full budget reduction plan by May 15th. Once we receive those plans, we should be in very good shape to close our fiscal year with a balanced budget. I want to say we really appreciate everyone's focus and diligence on this very important stewardship responsibility for all of us. Now let's turn for just a minute to the fiscal 21 budget planning process. Fiscal 21 begins on October 1st and runs through September 30th of 2021. I would say in a normal year, the university would be much further along in our budget preparation process for the upcoming fiscal year, but as we know, this is not a normal year. So the pandemic has caused us to really hit the pause button on that process for the past 2 months. And the main reason is we have big challenges with several key estimates that are necessary to build our budget for the fiscal year. And let's talk about what some of those estimates are and what information we need in order to build a reliable and credible budget for the new fiscal year. First, state funding. State funding or state appropriations make up about 1/5 of the university's revenue in any given year. The good news is the legislature returned to session this week with the intent of passing both the Education Trust Fund budget and the General Fund budget for fiscal 21. So we are hoping that they meet that objective of theirs and that sometime next week or the week after, we should have some very good information flowing to us about their intent for the higher education budget for fiscal 21. So that'll help fill a big part of the gap that we're missing to build our budget. Secondly, tuition makes up about 1/4 of our revenue at the institution. And you can imagine that we're having a difficult time estimating tuition now because that's built basically on enrollment and retention estimates for our student population. Our sense is that we will have a much clearer picture of that by later this month and into June. So by the time we build our budget in the July timeframe, we should have some very good estimates around tuition and enrollment and retention. Grants and contracts make up about 1/3 of our revenue budget, and interestingly, that is probably the most stable and reliable source of our estimates right now. So we feel pretty good about the data we have on grants and contracts. We will certainly keep monitoring that as we build our budget, but that's the one we probably have the fewest questions about right now. And then on the expense side, as Dr. Watts mentioned, we have a lot of hope and optimism. And Dr. Benoit mentioned also we have a return to work task force doing significant work right now around what the fall semester might look like. We will have expenses related to our fall semester that aren't in a normal budget for us. So for example, if we return to instruction and have to do social distancing, we'll need more classrooms, we'll need personal protective equipment for individuals, we'll have a higher cleaning standard, which increases the cost of maintenance and housekeeping. So we'll have to build all of that into our budget as well. And again, by the June timeframe, we should have a much better sense of what those expenses might look like. So all that to say, we understand what we need in order to build our budget, and we should be on pace to have a good budget put together sometime in July for an October 1 start. So I'll stop there and turn it over to Dr. Will Fernandy, the CEO of our health system.
Thank you, Alan. I've never been more proud of UAB and UAB medicine than I've been in the last few months. The amount we've done to serve the state has been amazing, but what's been even more gratifying to me is how we work together throughout this university. The health system is indebted to the university for work they did on getting dorms ready for us and hotels ready for us and short showers ready for those people that are caring for these patients on the front line. And I really want to take this time to thank all the faculty and staff and what they've done, particularly the people on the front line. I can't imagine the sacrifice they've made to care for the COVID patients in our hospital. We want to recognize these people, and to that end, we have developed a task force chaired by Dr. Seth Landefield, our chair of medicine, on how we will recognize the people that have gone above and beyond during this crisis. As Dr. Watts mentioned, the hospital was hit hard financially with because of the COVID reductions in service. Our projection is about $230 million by the end of the year, and to that end, as Dr. Watts mentioned, we did a wage and retirement, graduated wage and retirement cut until December 31st. And as I said on my my video on one, my pledge is the same that Dr. Watts said. If we can bring these dollars down, if we can pay these dollars back when our financials become available, we will. To make this reality, what we need to do is get the hospital open as quickly and safely as possible. And to that end, we've also have two task forces. We have one task force chaired by Reed Jones on how quickly and safely we can begin to bring patients back into the facility. And we have another task force co-chaired by Anupam Agarwal, Dr. Anupam Agarwal and Dr. Jean Larson on how to reopen the office-based services. Our biggest challenge is going to be similar to what Alan said, and that is our next year's budget. Our goal is to break even by the end of next year. This is going to be a challenge. We'll probably have about $120 million starting deficit to overcome, but I'm sure working together, we'll be able to do it. Thank you.
Great. We'll now open it up for Q&A. If you have a question, please drop it in the Q&A section. So Jimbo White has a question. Have all employees that have been furloughed at this time been notified? So Alesia?
Let me start with that, Rosie.
Great.
There are two groups of employees that are receiving notifications. The group of employees in what we call Category 3, which are the employees that were unable to work remotely and were not considered essential to be on campus. All of those employees have been notified. The second group of employees, there were individuals in Group 2, which were employees that were tasked to work remotely, and their supervisors were asked this week to help identify those who have been unable to work effectively or efficiently in a remote setting. So those contacts have not been made. The list came back from the supervisors yesterday, and so we will be working today and tomorrow with notification of all those employees. I will say that our HR team has done tremendous work in participating in those notifications. On Monday evening, after the Group 3 individuals received their notifications, our HR team stayed here and made phone calls to every individual that was on that list to answer their questions and just to provide a personal outreach. Certainly they were not able to reach everyone, but they reached the vast majority of folks on that list, and they will do the same with the notifications that are going to occur today and Friday. So Alesia, any additional comments on that?
No, thank you, Alan. we'll start working with that second group later today.
Okay, so Samantha Elliott Briggs asked, could you please repeat the first date of the fall academic semester and how will this impact first year students, freshmen? Pam?
So we're scheduled to be back on August 24th, but there are a number of scenarios that are being examined. And one of those could be a potential delay of the fall semester. So I can't really answer that question yet until we get some recommendations from the Transition Back Task Force. I know people are very concerned about what will happen and want to have some certainty. The difficulty is that this is an evolving situation and we're trying to be responsive to what we learn and to make evidence-based decisions about what might be best for the fall.
Great. An individual is asking, has there been any decision taken on the tenure clock extension for School of Medicine faculty? I know Dr. Vickers is on.
Rosie, can you hear me?
Yes, yes. The question is, has there been any decision taken on the tenure clock extension for School of Medicine faculty?
No decision at this time. We'll follow the university and the provost guide as regards to what we will do with that.
Okay. Kim Hope is asking, is there a possibility that the decrease in salaries will be reevaluated prior to December 31st, 2020 to Dr. Fernani?
We are going to monitor this every month and look at it. If I could do this, I would. As you might remember, we've had this situation before where we didn't give a raise and then the performance was better than we imagined and we gave the raise early.
Okay. Autumn asks, how do we find out what group we are included in?
I'm going to ask Alesia to respond to that one.
Yes, and Rosie, I want to make sure I'm clear and understanding, meaning if they're in work, the group to be furloughed or the group for salary reduction or?
Yeah, I was assuming maybe work group, and Jim can probably also help with this.
Okay. Well, the work group is on the website. You can go out to your work group. You can find it on the HR website, and you can click on an app that tells you which work group you're in. You put in your Blazer ID and it pulls up your work group. So you can find that on the website. And if you happen to have multiple assignments that have multiple work groups, it will indicate the work group for each assignment that you currently have.
And Rosie, this is Jim Bakken in University Relations. I can add on a little bit there. If you Google UAB work group, you'll find that website that Alesia was talking about where you can find out whether you're work group A, work group C, or work group F. And beyond that, the other three groups that are referenced in our communications are group 1, group 2, and group 3. 1 are those who were deemed essential to work on campus. 2 are those who are working off campus, and then 3 are those that were referenced earlier that are not working. And those assignments are given out by an individual supervisor. And so people can ask their supervisor for those groups.
This is Curt Carver. It's also on the My UAB portal. So if you go to settings, it links directly to the website that Alesia is alluding to. So it's on the My UAB portal as well.
Great. Individual is asking, and several people are asking, are additional furloughs possible later? So, Alan.
So I'll answer that one. Given what we anticipate with the budget for the remainder of this year, we are not anticipating additional furloughs. I think anything could happen related to the virus, but the path that we're on right now, we're very comfortable with the steps that have been taken, and that those steps will solve our the issue of balancing our budget for the remainder of the year.
We have several individuals asking, how would they be notified if they are indeed furloughed?
So they will receive an email notification, and then they will receive a call from HR. Is that correct, Alesia?
That's correct.
Okay. Julio Rivera is asking, in regard to classroom teaching in the fall, what are your thoughts on faculty members who fall in high-risk categories for COVID-19?
So that's one of the things that the task force is taking up, not only faculty in high-risk categories, but also students in high-risk categories as well, who might have underlying conditions that would make it more difficult for them to return to the classroom. So some of the things the task force has looked at is, could we offer both a synchronous and an asynchronous way of delivering the classroom instruction so that students might be able to take it in another format? Could the instructor come in an asynchronous way for that particular classroom? Could we have courses that were partly online, hybrid courses, and partly in the classroom? So there are a variety of different options to try to address that issue. But the idea around vulnerable populations has been very much a part of the discussion and thinking about how we need to make sure that we go again back to our principle that we're trying to protect the health of our community, and thinking about how one measure is probably not going to be appropriate for the entire campus.
There's a question for you, Dr. Watts, from Donald. Do you envision doing COVID testing for employees and students weekly and quarantining if they test positive?
Well, we do anticipate doing testing and having that availability. As far as quarantining or isolating, our safety task force, which is partially led by Dr. Vickers, will put in place those kinds of guidelines based on the input from our infectious disease and epidemiology experts.
Okay. We have a question for Dr. Fernani. When are UAB medicine employees, faculty, and staff going to be notified as to whether, sorry, that disappeared, whether they are not going to, whether or not they are going to receive compensation reductions?
Each employee, probably in the next 6 or 7 days, maybe about 10 days from Monday, each employee will receive an individual letter. And this is very important because part of this is the retirement reductions, and the retirement reductions, as Alesia could attest, are very difficult because of the ERISA requirements. So we have 5 plans, so each employee's retirement issue will be a little bit different, up to 5%. So everybody will get an individual letter soon.
Will the frontline workers in the hospital be receiving hazard bonus or lesser reduction in pay?
As I mentioned in my opening statement, there's not going to be hazard pay. You know, COVID will be with us for a long time. However, we want to recognize these staff in a meaningful way, and we've set up a task force to do that. Not only the direct patient care, but those that supported them. Many people have gone above and beyond, both on the health side and on the university side.
Rosie, I'll comment that there's been a formalized task force looking at both the clinical faculty and the research faculty as it relates to reduction or contributions to the losses in the health system. The clinical task force has gotten a set of plans for every department, and those will be reviewed and approved. And I think early next week, faculty will get a letter regarding the changes that will occur in compensation. Many of the leaders in the departments have had the conversations already with division directors, and faculty have some sense of what's coming, but they'll be formally put out during early next week.
We have a question. Does UAB qualify for CARES stimulus package from government? If yes, does that help offset some of the burden of these financial constraints?
So I'll take that question on the university side, and maybe Dr. Fernandy can on the health system side. The answer is yes, we do qualify and will be receiving stimulus dollars on the academic side of campus. We've already factored that estimate into the gap number that I had mentioned both this time and actually it was factored into the early gap estimate as well. The total dollars coming to the university is about $6 million. And then there'll be an additional $6 million that is directed at directly for students that we'll be administering as well.
On the UAB medicine side, it is substantial help. Right now it's approximately 60 million. We just got another 27 million today. It's about $60 million. However, as I said, before remediation, we're about 230. So that if you take that off, that puts us, down about 180 or so in reductions.
An individual asks, any idea of possible timeline for likely limited resumption of non-COVID human subjects laboratory research? Chris?
Yeah, I'll take that one. We are, as part of the larger university task force and integrating with the University of Alabama System Task Force, we're developing our protocols and our phased approach to resumption of research activities. It's our goal to do this with data in mind and with risk factors in mind for individuals. Our hope is to have our document and our plan squared away in the next few days, and then give people a little bit of time to get their operational plans for their laboratories, no matter what kind of research they're doing. So we're hoping that ideally it would be in a couple, 3 weeks, but I'm not going to share an exact date because we don't know one just yet. But we're working very hard that the resumption of research may be one of the very first things that we come back, start to resume normal operations.
Charles Alcorn asks, is there a rough estimate of savings by not having academic buildings fully staffed? For example, utility savings and supply savings.
Yeah, that's a great question. I'll go ahead and take that one. I just got a report, the preliminary report from our AVP for facilities, Greg Parsons, last evening. And for the month of April alone, the savings is about $380,000 in utility savings. So we are tracking that information, and it is part of the savings estimate that have been factored in for the budget gap closure that we need to do between now and the end of the year.
Then a follow-up question, what are potential next steps in cost-cutting measures?
So that's what we've asked the schools to provide to us by May 15th, both the schools and the vice president's units. We had gotten a preliminary list of those from the schools probably 5 or 6 weeks ago. And we asked them between now and May 15th to sharpen their pencil and really tell us what is most actionable between now and the end of the fiscal year.
Many individuals are asking about employee assistance. Could you provide more information about employee assistance?
Yes, Alesia, is that one you want to take?
Rosie, do you mean employee assistance, educational assistance?
Yes, tuition assistance.
Okay, because HR has gotten that question a few times. That's why I wanted to be clear. But actually, I'll talk about both. So educational assistance benefit is not changed. It is. It still applies like it always has for our employees and for their dependents. So there's no change there. The educational, the employee assistance that's offered through the Employee Assistance and Counseling Center also is still operational. They are seeing clients remotely and are remaining very busy. So we always encourage that anyone who needs their service or knows someone who needs that employee assistance service, please refer them, as they are there to help and are doing a great job helping all of our faculty and staff during this time.
Individual asks, will you continue to charge for parking?
So for the employees that remain on the payroll for this period, we will continue to charge for parking. As I had mentioned in the last town hall, parking is an essential part of the infrastructure here, and most of the costs are fixed. So those costs don't go away even during limited business operations. For the employees that will be on furlough, they, of course, will not be charged during that period of time.
Robbie Tyndall asks, will the state legislature take into consideration of the possible enrollment shortfall?
That's a great question. There is a complicated formula that the legislature looks at when they are deciding higher education appropriation, but we have a number of people that are making that case prior to this week and during this week as the legislature is in session.
In the last town hall, we asked about tenure and or promotion pay grade raises. Is there any further update on that?
I can respond to that. So this week I sent out a note to the deans reminding them that they needed to keep their promotion and tenure increases as part of their budgets. So as they think about their gaps, they need to make sure that they're accounting for any increases that they might need to do for promotion and tenure. So I'm really glad to report that we were able to work through that issue this week, and now we'll be able to continue to provide promotion and tenure increases as normal.
To Alan or Dr. Watts, do you envision any possible changes to the TRS contributions?
We are not anticipating any changes to TRS contributions.
Jenny Jones wants to know, will maternity leave be affected?
Alesia?
No, I don't anticipate any ways that the paid parental leave or any of the other FMLA related leaves would be impacted at all.
Are any of the building projects, such as the new science building, been put on hold?
We have not officially put any projects on hold. We do have a campus planning and facility advisory committee, the CPFAC, that meets quarterly and reviews projects as they come through and maintains our campus master plan. We will be discussing the status of projects at our next CPFAC meeting, which I believe is scheduled later this month. I'm not certain of that. It was scheduled for April, but we moved it because of everything that was going on. So it's a great question. It will be a topic of discussion, particularly the further out projects that were scheduled for subsequent bond issuances. We'll need to look at the timing of those based on how quickly we can resume operations.
A question about hospital employees who are participating in the teacher's retirement plan able to suspend their personal contributions until the end of the year. I don't know if...
Well, for the teacher's retirement plan, it's mandatory if you're a hospital employee. It's not a part of hospital LLC. They are not contributing to the teacher's retirement plan at all. And for the 403B plan, for hospital employees and the LLC employees, they can choose to make changes to their contributions. And how to do that is a part of the FAQs that's on the HR webpage. And it provides a direct link to the resources and a how-to to walk you through how to make any changes to your retirement plan, if that's what you choose to do.
Has a procedure been established for getting tested for the COVID-19 antibody? Doctor.
So two things. Number one, the first step of this is just to make sure we had an actually accurate, and that is a specific and sensitive test that we could rely on. And Dr. Neto and Dr. Sixto Allil have really demonstrated that the platform they're using works well. The second piece is that we are prepared to integrate this in our return strategy, but the current data shows that at the most only 4 to 10%, maybe at the most 15% of the people test positive. So it doesn't give much information except a baseline data point that we can retest in the future and determine who actually, or whether the population has increased in the number of those who've been exposed and who have antibodies that reflect potentially some immunity. We might use it in the context of healthcare workers, but again, the numbers are so small. The problem is, what do you do with the other 95% or 85% at most who test negative?
What happens to employees who aren't able to fully function in a remote status?
So that is the question that was asked of the supervisors this week. So if they are not able to function effectively and efficiently in a remote status, those decisions are being made now, and they are likely to be added to the furlough list.
Okay. Is the decrease in salaries concentrated on work group C alone, or other work groups at risk of this sliding scale as well?
So I will talk about the second part of that question, which is, are others at risk? All options had been discussed when we were going through this process. At this time, there is no intent to involve work groups A or F in that strategy, which is salary reductions. I will say that leadership, both at the university level and at the health system level, did take reductions in addition to the clinical staff reductions that have been put in place.
Okay. Will the hiring freeze be lifted after July 31st? If not, are there plans to lift it at a later time in place?
The hiring suspension on the university side is in place through the remainder of the fiscal year, not through July 31st. We will be, as the health system will, evaluating things as we go through these next few months. But our stated plan right now is for it to be in place, with the exception process that is also in place with it for essential hires. But it should be in place through the end of the fiscal year, so the end of September.
Any changes to new visa applications, H-1B in particular?
So I can answer that. At this point, no, there have not been any changes, and the Office of International Students and Scholar Services is fully functioning, and processes are moving along just as they always have.
Is offering early retirement being considered?
So I will again say that all options have been discussed. That is not a plan that's being considered for fiscal 20. When we begin to build our budget for fiscal 21, I would say that all options would again be on the table if necessary. So there has been some discussion of it, but no firm plan at this point. Alesia?
No.
Anything else?
Don't have anything else to add.
This is a more broad question. What if there is a resurgence of the virus? I don't know if Dr. Watts may want to speak to that, and Dr. Benoit.
Well, certainly in Jefferson County and in Birmingham, we have taken the strictest positions to try to limit that and to actually blunt the curve and begin to go down the curve. A concerning factor is that we have not yet begun to go down. In our hospital, we continue to run about 50 to 60 COVID positive patients a day. There was some trending downward, but it's not going down the way we would like for it to. In Jefferson County, the incidence is lower than most counties throughout the state, and certainly lower than Mobile and others who've had real increases in their numbers of cases. Across the country, and in New York City, for example, they've begun to flatten, but nobody has begun to go down actively. So there's a real likelihood that there could be a resurgence, and that's why continuing these safety measures as far as rigorous social distancing, hygiene, and face mask wearing in public are so important. If we don't do those things and we come back together, we will undo all the good that we've done through the pain we've suffered through over the last 7 to 8 weeks. So we have to take this very seriously. This virus hadn't gone anywhere. And again, there were like 6,000 deaths yesterday in the US. So we've got to be very, very rigorous about it. And we're going to have to try to control our behavior. And we can't control the behavior of the virus except by stopping its spread. There is no effective therapy beyond the remdesivir, which shows some partial benefit in severely ill patients. But that's not going to be a widespread therapy soon. And it's going to take some time for a vaccine. We've got a lot of pilot projects at UAB working on moving aggressively toward that. But as you've heard from Anthony Fauci and other experts, you know, at the earliest, it may be a year or 9 to 12 months. I will say at the same time, there is a vaccine that Pfizer has developed that we're going to participate in a study in the coming couple of weeks, according to Dr. Jeannie Madrazo. So we've got the right people working on that, but there could be a resurgence is the honest answer, but we hope not.
Another individual asked, with summer daycare programs for school-age children not opening as planned, will there be continued assistance with childcare through the Wendy app and other programs? I think maybe that might be directed at you, Dr. Fernani.
To be honest about it, we haven't given it any thought. So I'm glad somebody brought it up so we can think about it.
Okay. All right. Chris Kyle asked that contact tracing takes manpower and training. Is anything being done to hire and train people for this? Maybe Dr. Vickers and even Dr. Brown, you might talk about some of the things we're doing with COVID records.
I think two things. Dr. Benoit has mentioned this. A number of the health school-related deans have mentioned this. And in the concept of using students as well as we've talked about this with the Birmingham Service Corps with the city as well. So there's been given thought broadly about how we might engage individuals who are not in their full activities now to use them, but particularly we've talked about it with the city.
Okay.
Rosie, I can mention at least that we're also, in addition to that, we're working on a technological solution or partial solution to contact tracing as well. Many people that I see on this Zoom call have been involved in developing a app-based protocol for that. So we're working on that very hard here in the last several weeks. So stay tuned on that. In addition to that, we have, and I'll put in a plug for helpbeatcovid19.org. This is a symptom tracker that is available across the state of Alabama and beyond. We're also looking at that as a way to allow us to determine when and how people can come back to work at UAB and other universities.
Great, yeah, and it's a tool that's developed by our own faculty, Dr. Sue Feldman and Health Professions and Mohan Tirmalai. So please check that out.
Hey, Rosie.
Yep.
This is kind of late breaking news, but related to that. But Dr. Harris at Alabama Public Health has designated UAB in a formal letter to be partners in developing a tracing app for the state. So we literally during this call received the letter from Dr. Harris.
A lot of great work being done.
Great news.
So since grant funding, this might be for you, Dr. Brown, since grant funding is projected to be consistent, will there be any flexibility with hiring, transfer, and pay raise restrictions for both research staff and admin staff that manage grants?
So that is correct that in fact, I just got the information that for the month of April, we are again up in new awards by 12% or $37 million. And our faculty and administrators who make it happen, we've submitted 8%, 7% more proposals. So we're working hard there. The question was about pay rates or pay rate. I didn't hear the end of that.
I archived the question, so sorry.
Okay, I'll answer a question. I'll answer a question.
I can answer that if you're okay, Chris.
Please go ahead.
I think that the hiring and salary exception process that has been put in place, there is, through all of the exception processes, there are places to indicate funding. And so if you, as you go through those processes, if it's 100% grant funded or the level of grant funding is given consideration in the granting of the approval of those hiring or those HR actions. So I think that because I don't want to say absolutely yes, that's going to be the case, but that level of funding is definitely given consideration.
A lot of questions coming in about a vaccine. If a vaccine is developed, will it be made mandatory that UAB employees and students, have it like the flu shot? So, Dr. Watts and Vickers.
Well, we're getting way ahead of ourselves there. And that would be a decision that would obviously be dependent on circumstances at the time. We can hope very much that we have a very effective vaccine in the nearest possible future. But those kinds of decisions would have to be made when we're in that situation.
Okay.
I agree.
With HIPAA being a consideration, has there been any thought given to how employees will be notified if one of their coworkers tested positive once we return to campus?
Yes, I know we had some of those issues early on, probably 6-7 weeks ago, and I believe we put a communication process in place. We do want to respect HIPAA and FERPA guidelines, and I am trying to remember, I don't know, Alesia or Jim, we had pushed out some guidance to schools and VPs about 6-7 weeks ago around communication.
Yes, we did. And maybe we can find that communication and recirculate that now because I think I agree it was early phases of this. So it may be timely to share that information again.
There are a lot of questions related to childcare options and resources on the university side, if somebody could speak to that.
Well, I would say that our child care center will have to follow all state guidelines in terms of reopening. So we may also weigh in as well in addition to those guidelines. So the safety of the children and of the workers is of paramount importance in that setting. So we'll take whatever precautions are necessary. We are in very limited operations right now and providing again, very limited childcare services on a plan that was reviewed and approved by the state. And those services are being provided only to the children of frontline healthcare workers right now. Alesia, anything further?
No, that's correct.
We just have a few minutes left, so I want to give the opportunity for some closing remarks. Provost Benoit, and then maybe Dr. Watts.
I want to reiterate our thanks to the campus community, to faculty, to staff, to students who pivoted very quickly so that we could get past the first portion of this. But as the president said earlier, we're not out of it. There's still a long way to go here. And so we're going to need your continued support as we try to figure out the best ways forward. And we're doing our very best to think about different scenarios and different options and considering different issues to deal with this very evolving and incredibly extraordinary circumstance that we find ourselves in right now.
I would say the same that others have said, other leaders have said, how proud I am and we are of all of our employees and our students and our alumni and our community for working so well together to support each other and to try to fight this unprecedented epidemic. We will come out on the other side of this. We don't know exactly when that will be, but in between, we're going to do everything we can to take care of our employees and our students and our community as well as possible. We won't leave any stone unturned, and we're going to work very intensely to beat back and overcome this virus. But in the meantime, we need everybody engaging to the best of their ability to do the right things that help us fulfill our mission each and every day and to serve all of those who are so dependent on us. It's an honor to serve alongside you.
Thank you. This wraps up our virtual town hall. We will collect all the questions. There's a lot of questions that came in. We will take the most commonly asked questions that we did not respond to, and we will have an article in the e-reporter, the next e-reporter. So be on the lookout for that. Thank you for attending. Goodbye, everybody.
Thank you all. Have a good day.